Hello, good evening, good day, good afternoon, good morning, wherever you are in the world. Thank you for joining the Black Belt Academy of Surgical Skills. My name is David O'Regan, and I'm the Director of Faculty of Surgical Trainers for the Royal College of Surgeons of Edinburgh. I'd particularly like to welcome the newcomers and followers to the Black Belt Academy of Surgical Skills from Sudan and Nicaragua. If you, like them, have just joined us, thank you very much. And for those who are returning and the 2,400 followers, welcome and thank you again. I'm very conscious, particularly in the UK, that many of our younger surgeons in training are not getting hands-on experience and feel that they're losing their skills. I recognize that, and many consultants recognize that too. I know, training in martial arts with my son, if I'm not practicing my katas and movements every week, very quickly you become slow and rusty. The Black Belt Academy of Surgical Skills is here to help you hone your skills, offering low fidelity models that give you feedback and feel on how well you're doing. That is why I prefer organic materials rather than synthetic materials in the Academy. I'm very conscious of the fact that while I'm demonstrating this, I'm not wearing gloves. And that is because at home, I don't expect you to have a source of gloves. And I think in the learning in the beginning, that's not necessary as I'm not using any dangerous material. However, we know gloves have a lot of different uses. In the cold weather, designed to keep your hands warm, or when working in the garden to protect your hands from injury and thorns. But surgical gloves should be there to enable you to operate and feel, and they should not be worn like marigolds for washing up dishes. The surgical gloves are fine latex that should comfortably sit around your fingers, and if you get too much flexion or numbness in your fingers, then your gloves are too tight. Likewise, there should be no air at the end of your fingertips, so they should fit comfortably and snug. You will get used to wearing a certain size of glove and a certain material. That will come later, but you can feel through the glove. And I personally am not an advocate for double gloving when doing surgery because double gloves actually reduce your feel. And for a surgeon, wearing gloves in a sterile field with alcohol in your hand and not using hypodermic needles, your risks are smaller than those in other clinical areas. So let's move on then to knots. And what I've been talking about is feel. I noted on social media during the week that junior doctors were having competitions and racing each other, throwing knots on models. And as they're doing it, they're throwing the knots down, and it does look very impressive when you can throw the knots down. And I recall working for an eminent cardiac surgeon who used to ask the scrub nurse facetiously to squirt some water on the sutures he was tying when he was putting in an aortic valve, because he felt he was tying them so fast, he was wanting to reduce the friction and the steam coming off the suture. It's not speed that I want to teach. That will come naturally with practice and correctness. The important thing about a ligature is that it's placed in the right position, bedded down, and as you tie the knot, you're not at risk of pulling the ligature off. Stick to those principles, the rest will follow. Well, it was Hippocrates, the father of medicine, who described the first ligature back 450 BC, and then further Galen or Claudius Galenus, the Roman soldier in 160 AD, who also described ligatures. But they didn't really come into play for another 1,500 years until Ambrose Paré, a French barber surgeon and physician to the kings of Henry II, Henry III, Charles IX, and Francis II, described a ligature. He is well known for his knowledge of anatomy and very adept in the battlefield, dealing with battlefield injuries. And I suppose this is where his skill came from. Knot tying is critical in surgery and is one of the first skills a learning surgeon develops. So let me show you some of the models we have in the Black Belt Academy of Surgical Skills that will enable you to practice and reinforce some of the principles that we hitherto have mentioned. So if you hold on, I'll transfer you across to the overhead cam, and I've rigged up my own suture model, a knot tying model. All I've got is a block of wood, 2 elastic bands, and I've placed pencils underneath them just to lift it off the edge. And you can use this to tie any knot, any place, anywhere. And it might seem like a magic trick because I don't imagine that you're going to be able to see the suture that I'm using. But I'm starting with this deliberately to demonstrate a point. My point being is that the feel of the suture is critical in pulling it down. And it's almost as if by magic, you can see that I'm tying these together with a 7-0 suture. And the important point is that I'm not pulling the suture, and my finger is on the knot each time, keeping it in place and stopping the displacement. Whether you're tying with a 7-0 suture like that, or a thicker suture, the principles are the same. And all you need to practice your knot is a ball of string, a rubber band, and something else to tie, and I'm using a coat hanger to demonstrate that you're not moving. So let's come on to those. First, to refresh the memory of those wanting to learn knots and tie knots. I've got a piece of shoelace here. One side is colored black, the short side, and the long side white. And throwing sutures is essentially taking your finger through a loop and bringing it down flat each time, like a reef knot. When you do that, you'll find that your finger hold has changed. Create another loop, middle finger through, and take it away. And you'll see there a reef knot, because as I've demonstrated before, a reef knot or flat knot, no matter how hard I pull, will not come undone, as opposed to one of these cross knots or granny knots that if you pull it, you see, it comes undone. And it was Mr. William Walter Frederick Southwood, my first trainer in 1987, who would watch every single knot and repeatedly say crossed or uncrossed flat knot. And the first important principle is for you to learn how to get a series of flat knots, because that is secure. Now, the secret is, when tying a knot, to bed it down. And in that respect, it's as much easier to throw the same direction. And effectively, you create half hitches and you can bed the knot down and then continue crossed and uncrossed all the way. Now, the difference between a piece of string or a braided suture and a monofilament, which is essentially, as described, a thin bit of plastic or polypropylene that is drawn out into a single string, is the number of throws. And I see many people really enjoying themselves. Look at me, I can see it throw lots and lots of knots, but actually during the course of an operation, particular cardiac operation or valve replacement, there are many knots to throw. And if you're putting more than is necessary to do the job, you're wasting your effort and time, and that all adds up. Because remember, as I said, what the samurai said, don't do anything useless. You need to secure the knot and move on to the next. So in practicing your knot tying, having got the concept of taking the knot down flat, try putting something like a coat hanger on a table. And you can see now that I'm not lifting this up at all as I'm throwing the knot, because I'm disciplining myself to put my finger on the knot or beyond it. You see, I'm not pulling it off. And this is an important skill to learn, particularly if you're tying at depth. And I recall my days as a general surgeon, the middle rectal artery being rather difficult, and some vessels you tie are going to be at depth, and you're feeling them down rather than seeing them down. So do make sure, as you're practicing, that you're saying to yourself, uncrossed knot, but each and every knot is placed down deliberately and your fingers across the knot so you're not lifting it off. Of course, this can be further practiced using paper cups. And you take a cup and you place the cup on a plate with a bit of blue tack, and you place a pencil through the cup, and now put that on the plate. And as a substitute, an easy thing I find in the UK is either string, bit of fishing gut, or I prefer dental floss. You might not have it where you are, but string or fishing gut is perfectly adequate. But I like the dental floss because if you are aggressive in tying your knot, the dental floss will break. Now, the important thing about this, tying at depth, and this is 1 phalanx deep, is that I got to make sure my finger is across the knot and that I bury the knot down and make sure it's buried down and held in place, because otherwise, if I'm pulling and not putting my finger on the knot, the cup is moving, but you run the risk as well of pulling the cup off the plate. You can test whether you are secure in doing this by getting a pair of forceps and simply seeing if you can move your dental floss along the edge. Of course, you can make it more challenging for yourself. You're now taking it at depth at 2 phalanges deep. Same principle. Put it on the surface. And I've always promised myself I need to get a Leahy or a Shaughnessy or something to help the passing of the needle behind. But I haven't yet, and therefore you're going to have to bear with me as I fiddle to get it round. Okay, there you go. Make sure it's on the surface. You can see I'm not cheating, comes off easily. Push it down, and now, again, this is actually teaching you to tie at depth. The important thing is that your action is deliberate every time, that I'm making sure that I'm across the knot and I'm bedding it down without pulling the cup off. There you go. Again, you can test yourself very simply. Does it move? Now, monofilaments do require more knots and more throws because, by definition, the monofilament of plastic is slippery, so you put lots of throws on it. However, I would caution you, and the caution for lots of throws for monofilaments, we're using them to tie, to close abdomens, to close layers, that if I take this needle that has got too many throws on it, and if I was doing that to close the aorta, if I took it across the anastomosis again and pulled it through, it's very likely that I pull the knot itself through the tissue, and that would cause a bleed. But as I was practicing with my banana, and noticed that I've taken and eaten the banana for energy, I thought to myself, I wonder, would this be a good exercise, not only for instrument tying, but for hand tying with a monofilament? And I believe it is. And I will just demonstrate to you why. Just going to take the needle through. So just with the banana skin, can I bring the banana skin together gently with a monofilament without lifting it off? And it is awfully difficult. I got myself in a mess there, didn't I? But the important thing is that if I pulling too hard, not only will I tear the banana skin, I'm lifting it off the plate. So try that yourself. Lastly, most our ligatures need and ought to be secure and hemostatic. So one way to do that is to practice tying off balloons. Okay. Again, we would use surgical gloves, but they are expensive. Balloons are less expensive. And I've partially inflated the balloon, put a hemostat on the end, and we're going to now tie the neck off. So if you've got any party coming and you needed to blow up balloons, this is an opportunity for you to practice your knot tying. So let's make sure we got it down securely. Fingers on the knot. I'm holding it, and I'm holding it in place for as long as I say, finger on the knot. Taking it down. Okay. And let's see how that works. Simply cutting off the end. I think I'll be happy with that ligature. Certainly not leaking. And this is one I did a few hours ago. Indeed, I found some tied balloons from our last iteration of knot tying from Christmas, and they're still up. So the principles of knot tying are really quite easy. One, practice with a piece of string and be sure you understand the concept of flat knots, in other words, reef knots. Two, then practice on a surface such that when you tie the knot, it is not moving around at all. Try getting the right pressure by using your banana skin and tying the knot such it doesn't tear the banana or lift the banana off. And lastly, secure your knot by trying it on a balloon. They may seem silly exercises, but readily available, and you can do it at home. There's no reason in this current climate where access to theatre is limited. You cannot practice these simple basic skills at home. And the models offered reinforce the principles and will keep your lightness at touch. And as I said, can you feel you're not going down? And be certain that it's secure and safe. I'm not interested in speed. That will come as you develop your skill and your natural rhythm. Continue to send pictures in of your practice at home. I do enjoy seeing them and look forward to your comments. I welcome you again to join me next week on the Black Belt Academy of Surgical Skills, where we complete the series and I take you through further tips and tricks on how to be a good assistant. Because good surgeons are good assistants, and good assistants are good surgeons. Join me same time next week. Thank you very much indeed for following the Black Belt Academy of Surgical Skills. Be safe and be well.